welcome anybody to this ERN-RND webinar on improving care for rare disease patients in Europe, which is part of the rare disease campaign. The objective of this event is twofold. Firstly, to share different perspectives on care and of rare disease patients, as well as how it can be improved in Europe. And secondly, raise awareness for the Rare Disease Day. And of course, in particular, we will be focusing on the care of rare neurological disease patients. Before we move on, I would like to say a few words about the Rare Disease Day, which is in a couple of days, and for those who may not be familiar with this campaign. Rare Disease Day is an initiative of EURORDIS, an alliance of rare disease patient organizations in Europe, and takes place every year on a rare date, which is the last day in February. And this year, it's taking place on Sunday, on the 28th of February. The aim of this global campaign is to raise awareness on rare diseases amongst the general public and decision makers about rare diseases and their impact on patient lives, which represent around 300 million people worldwide. We encourage you to participate virtually in any way you can. Spread the word and visit the Rare Disease website for more information and how to get involved. You can find the respective website under www.rarediseaseday.org. We will now start with a short presentation and finish the webinar by discussion with speakers. And by all means, please be invited to post your own questions. So I will be trying to pick up your questions through the chat. So please use the chat function to ask questions after the presentations. When you leave, you will be asked to answer a short survey to get your opinion on improving care for rare disease patients and also to help us improve potential future webinars. And of course, we would highly appreciate if you could take a couple of minutes to fill it in. So the agenda of this 1-hour webinar is as follows. We will be having 5 short presentations. So myself will be beginning, and I'm really glad that in addition to myself, we have 4 esteemed experts on rare diseases on the panel. So the second presentation will then take the clinical perspective in Hungary, which will be given by Professor Judith Molnar from the Semmelweis University in Hungary. The third presentation will be given by Dr. Sophie Bernichtein from the BRAIN team in France and will take the perspective of the BRAIN team, which is the French National Rare Disease Network for rare neurological diseases. The fourth presentation will take the perspective of the neurological patient community in Europe. And this presentation will be given by Donna Walsh from Efna. The fifth, and by no means the least one, presentation will be given by Tobias Menzel from ELA Germany and will take the perspective of a rare disease patient in Germany. After these presentations, the Q&A round will follow. And as said, you can ask questions, but also the speakers will have a discussion among themselves. We will be ending this webinar around 4 p.m., a bit prior to 4 p.m. with a few closing remarks and a few remarks on next steps. But now I will be starting with the first presentation. And next slide, please. And I will be taking the perspective of the European Reference Network. So for those who don't know, the European Reference Networks are virtual networks involving healthcare providers, so expertise centers across Europe. They tackle complex or rare diseases and conditions that require highly specialized treatment and concentration, as well as sharing of knowledge and resources. Next, please. So the concept of European Reference Network is very much to address the rarities associated with rare diseases. And it's not only patients that are rare, but also experts, data and knowledge, and healthcare structures and systems. And these rarities are addressed by cooperation between the EU member states. Next one, please. The main areas of activities of European reference networks are virtual healthcare, knowledge generation, and knowledge dissemination. Next, please. And just to give you an example and focus on the European reference networks for rare neurological diseases. So at the moment, this network, the network I coordinate, has 31 members from 13 EU countries. Unfortunately, it's actually 30 members from 12 European countries because due to the Brexit and due to the legal context the ERNs are placed in, the UK center we had before the Brexit had to leave the ERN. However, by mid of this year, the network will be expanding and we will be adding 14 new EU countries, which means that we will almost have expertise centers in all European member states, EU member states. Next, please. So in terms of disease expertise, we focus very much on rare neurodegenerative diseases and rare neurocognitive diseases. And just to give you an impression on numbers, so the centers involved in our network see approximately 50,000 patients per year, of which, due to the disease expertise we cover in our network, the majority are adult patients. And we have approximately 11,000 new patients per year, which leads me to the next slide and the thing I wanted to explain how ERNs can contribute to improve care for rare disease patients. And that is actually, no, next please. That is actually to improve diagnosis. And to improve diagnosis is one of the major objectives we have in our network. Next please. So what can an ERN do to improve diagnosis? So first, an ERN can, because it's a network, share knowledge and data, making sure that all persons affected by rare diseases, once they come to medical attention, are being diagnosed according to the current medical literature, the current medical knowledge. Secondly, we do develop and implement care standards like diagnostic flowcharts and guidelines. Thirdly, we use the network's collective intelligence for diagnostic consultations in the e-health system which the ERNs use, which is the clinical patient management system. And fourth, of course, we train new experts for rare diseases. However, having the knowledge at the point of diagnosis is one thing. The other thing is really to have a respective organization of care. And that's what care pathways are about. And we develop care pathways and assess care pathways with a particular focus on ERNs. This improves, no, sorry, go back. This, of course, helps to improve diagnosis in the ERNs, but it also addresses inequalities with respect to the diagnostic care provision in the different European countries. Next one, please. So, but it doesn't stop there. ERNs also drive research and benefit from research. And the example I wanted to give you with respect to diagnosis is SOLVE-ID. So SOLVE-ID is a European flagship project and in which really hundreds of rare disease experts team up to actively share and jointly analyze existing and new patients' data. And the main ambition is really to solve unsolved rare diseases. Next one, please. So what we do in SOLVE-ID is we really use the data being shared through the ERNs, and the ERNs are really the basis of SOLVE-ID in order to do a massive reanalysis. So we reanalyze unsolved exomes and genomes. We actually apply novel omics approaches, and in collaboration and reaching out to similar collaborating international initiatives, we do matchmaking. However, the massive data sharing and collection we implement in Solver-D can also be used for future application of advanced methodologies like machine learning. Next one, please. So in the end, what Solver-D does, besides solving the unsolved rare diseases, it's really gather knowledge on and utility of diagnostic technologies, practices and programs with regard to specific groups of rare diseases. So what we do is try to find out which diagnostic approach, which diagnostic technology is the best fit for a specific rare disease group. And this knowledge then is being fed back in a translational loop to the respective ERN clinical and diagnostic centers, by which the diagnosis of rare diseases in Europe can again be improved. The second presentation will be given, as already said, by Professor Judith Molnar. Professor Judith Molnar will be taking the perspective of an Hungarian clinician. Before we start with the presentation, a short introduction. So Professor Maria Molnar is Professor of Neurology, Psychiatry and Clinical Genetics, Director of the Institute of Genomic Medicine and Rare Disorders at Semmelweis University of Hungary, elected President of the Hungarian Human Genetics Society, co-chair of the Neuromuscular Scientific Panel, and Management Board member of the Neurogenetic Scientific Panel of the European Academy of Neurology. She's member of ERN and the coordinator of the Hungarian National Hub of the ERNs. So please, Judith, take the floor.
Thank you very much for the kind introduction. Good afternoon, everyone. In Hungary, we have a strong commitment to rare neurological disorders, since neurogenetic is in the focus of our research since the mid of the 90s. Here's the next slide. In Hungary, we prepared the first national plan of rare disorders in 2013, and 2 years later, the Minister of Human Resources appointed the Hungarian Center of Expertise. These are the University of Debrecen, Semmelweis University, University of Szeged, and University of Pécs, and the National Institute of Oncology. Here's the next slide. Presently, we are preparing the second national plan. And when we are preparing the national plan, we are performing always a SWOT analysis. The Hungarian strengths are that we have multidisciplinary clinical expertise working with holistic approach, and we have academic rare disease networks. We have nice rare disease biobanks at the different rare disease expert centers, and we have supportive legislation for improvement rare disease healthcare and research. Some of the universities, we already started to integrate the rare disease knowledge into the educational curricula. And we have a very good national umbrella patient organization called RIROS. Of course, we have some weaknesses. Many of them are related to financial issues, since we have financial capacities which are scarce, and due to reimbursement problems, sometimes the introduction of new technologies is difficult, and the quality control of the diagnostic laboratories is variable in the country. Unfortunately, presently we do not have the national rare disease registries, and we have a relatively low budget for the rare disease research grants. And finally, the health and the digital knowledge of many citizens is relatively low. We have opportunities, of course, and many of these opportunities are related to the ERNs. For example, to uniform guidelines and protocol, and to establish the national rare disease registry. I think the ERN facilitated this registry development. And we are able to optimize the cross-border patient care at the European level, and to strengthen the cooperation with the rare disease research partners when we are participating in different European research projects. And the opportunity to improve the cost effectiveness as well. Of course, in all SWOT analysis, there are some traits. For example, the lack of harmonization of the interests of the different stakeholders, or the inflexibility of the reimbursement system, regarding the different diagnostic approaches and the different access to the orphan drugs. And in many cases, we face the lack of human resources, and we have sometimes not enough social support for patients with rare disorders. Please, the next one. After the first call from Hungary, we had 13 healthcare providers in 10 different ERNs. And in 2020, the National Hub gave us the opportunity to be an affiliated partner in 6 further ERNs. And please, the next slide. And now, after the second call, we had 11 successful new applications for full membership in 9 different ERNs. So presently, we can say that we are present in all 24 ERNs, and we are very happy for this. Yes, the next slide. How can they help us in the Hungarian rare disease patient care? We can uniform the directives and the resolution, and it supports us with a very good collective knowledge, which is a European network for clinicians and researchers, and it's a very important part of this is the CPMS. We can disseminate with the ERN the knowledge, so facilitating the flow of information exchange at national and international level as well, and offers us a really great training opportunities. And last but not least, these network may help us in the recruitment of patients with in different clinical trials and to use the shared registries. Please, the next slide. Next slide, please. I would like to say you a few words about the clinical patient management system, because I think it's a very important part of the ERN. It really helps us in the cross-border patient care. You can see here the platform, the Hungarian platform or institute platform, with the cases which are already uploaded. We can upload cases for diagnostic purposes, and we can upload cases when we would like to know the opinion of other experts regarding the management. Please, the next slide. For example, this is a small girl with ataxia where we already had the diagnosis, the genetic diagnosis, but we would like or wanted to have some support from other experts regarding the management. So this, how does it look like? This is the side. You can see the patient history. And then at the bottom of the slide, you can see that who was invited and what has happened during the consultation. Please, the next slide. And when we are discussing the role of the ERNs, I think the motto of the ancient Greek storyteller Aesos is especially actual. We can say that united we strength and divided we fall. Thank you very much for your kind attention.
Okay, thank you very much, Judith. I think this was very nice and a very good perspective, also with a concrete example how the CPMS can be used to give benefit to the expertise centers which participate in ERN-RND. So the next presentation will take the brain team's perspective, and the presentation will be given by Sophie Bernichtein. So Sophie is the project manager at Brain Team, the French network for rare neurological diseases. And Sophie coordinates the actions of a Brain Team with all stakeholders. She also actively participates to ERN activities. So what is Brain Team? Brain Team coordinates the reference centers dealing with rare diseases of the central nervous system in France. So that's a national network. And it's basically ERN-RND, but at the national level. I don't know if Sophie agrees with that.
That's correct, I agree.
Okay. So then, please, your perspective.
Thanks. Thanks for inviting me to participate, and good morning, everybody. And I've been asked to bring the French perspective into the discussion today. So next, please. And so I would like to start this presentation by this French perspective, which is a famous bassin d'Apollo at the Château de Versailles that you might know. And from that side, the perspective is unique. But if you make a U-turn, next, please. The view looks completely different from this side, and you will agree then perspective is just a matter of point of view. So the French perspective of today will be in fact my point of view as regards to my 5 years experience leading a brand team. Next, please. I will try to list first the next challenges to enhance the care for our patients in Europe and what is actually experienced in France as related to this topic. And I will illustrate this through 6 examples. The first one challenge for me is to reduce the diagnostic odyssey, since it's obvious that without any experts, there's no possible. Patients live for months or maybe their entire lives with an diagnosis, and obtaining a diagnostic can be a long and difficult journey that can moreover be ending sometimes in receiving an incorrect diagnosis. So in the last 3 years, we have started developing a campaign to raise awareness among general practitioners, and with 2 major goals. First, to instill them the culture of doubt. Could it be a rare disease when they are when they are facing a panel of clinical, unusual and complex symptoms? Could it be a rare disease? And then to encourage them and to teach them to refer the patients to RD experts, which is always the case, because for us, GP are the key actor in reducing this diagnostic odyssey. Next, please. And the second for us could be to reduce the diagnostic deadlock, because without any diagnostic, there's no proper care we can be put in place. And this is really about solving the unsolved rare disease patients for whom we are unable to explain the etiology responsible for the disease phenotype or predict individual disease risk or rate of disease progression, and etc. So it's very important to know are they, and mapping the unsolved RD patients is really important. And actually in France, we are trying to list RD patients cohorts according to diagnostic status and stage. And this will enable to gather phenotypes of unsolved patients according to their diagnostic status. And to map this will really help us to identify novel RD entities, allowing and to retarget hypotheses, to propose new molecular approaches, or to enhance the diagnosis. Or even this could be able to help us to redesign policies, for example, to orientate policymakers to favor access to free genetic testing for all RD patients, for example. Next, please. The third challenge for us could be to homogenize RD coding, since proper data favors proper care. And knowledge in RD depend on data collection, since patients are not many, of course. So improving this knowledge will depend really on the quality of data which is recorded. And France has started a national challenge, since the key for sharing proper data is encoding data the same way through every RD experts, and to encode them with a quality of data. And Orphanet is quite helpful in that way, but not only. And in Brain Team, we are editing common rules for encoding RD data. And right now, we are teaching reference centers to encode properly the patients in the same national database and according to common rules. Next, please. Then one of the challenge for us also is guidelines production from ERNs, since for us, authority networks favor proper care. And one message from France today could be that we need ERNs authority to facilitate recognition of common practices or expertise at national levels. And this is really important. Next, please. Another challenge to enhance the care for RD patients in Europe could be social care, since care is not only care, but also social care. And in Brain Team, social care is one of the priority of the network also, with several projects focusing on the daily life of patients and helpers regarding their professional activities, scholarization, disability, and patients and helpers training sessions that we are trying to put in place. And the last challenge for us is to promote access to medication and moreover to authorized, available and affordable medicine, because a good medication for rare disease patients is a medication that is both available in the where the patient lives and which is available for them. And Eurodis, as you may know, has conducted many surveys on access to orphan drugs and has worked a lot on member state pricing negotiations. So it's really a topic of interest at the EU level. But for the patients, we have started in France this year to consider the policy of compassionate use of medicines. Brain Team is enrolled in an ambitious work on the writing of a new national law on the subject to facilitate this authorization. And we are at the moment listing non-authorized medicines actually prescribed for R&D patients. And we are working on conditions to give an easier access to compassionate prescription. Next, please. So I'd like ending this presentation with this European map of culinary horror to remind you that the perspective is again really a matter. I don't have to share my point of view on the care of RD patients, neither share a dish of frog legs with me, but this to say that this is a France point of view, but the French point of view, but this is the one I wanted to share with you today. So I'd like to thanks for your attention, and I wish you a very happy Rare Disease Day next Sunday.
Thanks a lot, Sophie. So I like the map. I mean, and it kind of point out the heterogeneity we have to deal with in Europe. However,
Yes,
I think, yeah,
exactly.
I think the issues you mentioned are actually shared issues across all the European countries. So I think you have found a few solutions or a few approaches in the French network, and I think we might be getting back to that during the discussion.
With pleasure.
But for now, yeah, I would like to thank you again. So the next presentation, the fourth one, will now take the perspective of the neurological patient community in Europe. And I'm very glad that we have Donna Walsh today here. So Donna is the Executive Director of the European Federation of Neurological Association since June 2012, where she oversees the strategic direction of EFNA and leads in the creation and implementation of its annual work plan, projects and activities. He's also active in representing EFNA and the neurological patient community externally, including as a current board member of the European Brain Council and as a member of the European Academy of Neurology's European Affairs Subcommittee. So EFNA, what is EFNA? The European Federation of Neurological Association, EFNA, is an umbrella group representing pan-European neurological patient groups. Its vision is to ensure a better quality of life for people in Europe living with a neurological disorder. With that, the floor is yours.
Thank you very much, Holm, and thank you for the invite to participate in today's meeting. So as you can see, and as Holm just explained to you, EFNA is an umbrella of pan-European disease-specific groups. And we include many of the well-known or more common neurological disorders like epilepsy, Parkinson's disease, multiple sclerosis, stroke, migraine, for example. But you can also see on this slide that we actually include very many rare neurological disorders. So you can see here we've got dystonia, we've got brain tumor, we cover myasthenia gravis, some of the retinal dystrophies, ataxia, Huntington's disease, CMT, and many of the neuromuscular disorders. And one of our newest members who'll be joining us in April actually comes from the peripheral neuropathies arena. So I think actually the largest percentage of our members does come from the rare neurological disease sector. And I think it's important to remember that so many of the rare diseases are neurological in origin or have a major neurological component. And there's certainly a lot of crossover between the two. Next slide, please. So a couple of weeks ago, I was invited to address a meeting to talk about some of the commonalities or the common challenges in the rare neurological disease space from the patient perspective. And a lot of this has actually already come up in the discussion today. And I think from what we've heard in terms of the European reference networks or similar networks at a national level, a lot of these challenges are already being addressed. And we need to ensure that the solutions that we're seeing are sustainable in the longer term. So I think for people here, I'm not telling you anything you don't already know, but it is important maybe to re-emphasize some of these challenges before we think about the solutions. I see a lot of EFNA members in the audience as well. So again, if I'm missing anything here, I hope they'll jump in and add to this list in the chat. So we've heard already about the lack of access to a correct diagnosis. I don't need to labor that point. And it's not just the delay in diagnosis, but also the wrong diagnosis that can lead to unnecessary and even dangerous interventions in the space. The lack of information, not just about the disease itself, but I think probably more problematic is where can you obtain help from the qualified professionals that are needed to help manage and treat these conditions. The lack of scientific knowledge, this came up in the introductory presentation. We really need to better understand the basic mechanisms that are at play in the area of rare neurological disorders if we are to develop these therapeutic tools of the future. For so many of these diseases, we have no cure, but for a huge majority, there isn't even a treatment that is available to patients, and that really is something that has to be addressed. Now, if there's no pharmaceutical treatment, the focus then shifts to ongoing management of these diseases. And as we heard earlier, this often includes the multidisciplinary care team. There's a whole raft of symptoms and a whole raft of needs that just one healthcare professional cannot hope to address. And we need to ensure that patients have access to this appropriate quality healthcare. And that is sorely lacking in places where ERNs are really not embedded into the national healthcare systems. The high cost of existing drugs, that's something we all know about and something that we continually to advocate for access to these treatments. But this is exacerbated by what we heard earlier, this inequitable access to care across the EU. So patients in some countries having access to treatments that are on the market and patients in other countries who have no hope of ever gaining access to the same treatment, despite the fact that they have been diagnosed with the same condition and they live within the European Union. And then the social consequences, and Sophie alluded to this as well, that we can't just go down this sort of medical scientific rabbit hole and forget about the fact that at the end of the day, these are people who want to live normal lives. We need to protect quality of life. We need to protect access to education or to employment. And we need to address all of these issues that continue to crop up in terms of stigma, isolation, discrimination, not just for the patients, but also for their families and for their caregivers. Next slide, please. Now, in terms of challenges, obviously, that's a long list and there's definitely a lot to be done, but things can be done. And I've pulled out some recommendations from a consensus statement that we were working on over recent weeks. And this arose from a roundtable event that many of you participated in and spoke at before Christmas in partnership with the European Huntington Association. And this consensus statement really distilled the conversation that we had before Christmas and came up with some of these recommendations that the experts had put forward at that time. Now, when I was reading the statement before this event, I realized actually none of these recommendations are specific to Huntington's disease. All of these recommendations can apply not just to rare neurological diseases, but actually to neurological diseases as a whole. And I think clearly there are opportunities and hooks now on the table for us where we can move these recommendations forward. So the first one's quite obvious. Addressing the gaps in treatment for patients living with rare neurological disorders. And clearly the ERNs are the central pillar through which we can make this happen. And a lot of this has already been discussed in terms of the offering that the ERNs can bring to patients at the national level. The second one is ensuring research priorities have patients in mind. And this, I think, is really, really important. We need to understand the unmet needs of the patient community. And the only way we can do that is by involving patients in research and development, not just as participants in clinical trials, but actually as co-creators of what research and development is going to be funded, what sort of methodologies are going to be put in place, what are the endpoints that matters most to patients, and how can we then ensure that this research is translated into treatments or treatment approaches that really benefit the patient community and really address their unmet needs. If we move to the next slide, it's very wordy and I'm not going to go through it because we could spend all day talking about this particular one. But basically, if I was to synopsize this slide, it is around optimizing the momentum we now see from a public health perspective at EU level. So if I had been giving this presentation a couple of years ago, I'd be saying to you, we're not sure if DG Santé, so the health department at the European Commission, will be in existence after the next EU elections. Public health is falling off the table, the competencies are all at a national level. You know, are we wasting our time? 2 years later, and with a pandemic raging across Europe, public health is back on the European agenda in a huge way. It is what is really driving policy at the EU level and absolutely at the national level today. We've heard calls for a newly strengthened European Health Union. And not just that, there are a lot of files on the table currently that really could help us position rare neurological disorders and the ERNs as a real solution for Europe. The pharmaceutical strategy, the review of the orphan drug regulation, EU cooperation on health technology assessment, the digital transformation of healthcare, cross-border healthcare, and last but not least, this post-COVID recovery planning. So all of the EU policymakers now are talking about how do we future-proof, how do we build resiliency into our healthcare systems? And what we don't want is that discussion moves off in a direction where we start talking about pandemic preparedness and communicable diseases only. We really need to think about how this pandemic has affected our communities. I saw a statistic earlier from Eurordis saying that for 84% of rare disease patients, their care was halted or delayed in some way during the pandemic. And we need to ensure that that doesn't happen again, that there are mitigation actions in place and that we can continue operating in these healthcare systems of tomorrow. So for me, I think we really need to start to think about now is how we sell the ERNs as a political solution at an EU level, so that that then is translated into policy at the national level and in the member states. And then I have one last slide, which is often I'm asked about, what can the rare disease community learn from neurology? And actually, I think this is the other way around, because the rare disease community has been so innovative in its approach to advocacy and policy and patient engagement for many years. And I think all of us can learn from that. Because of the low numbers of patients dispersed across the continent, you've had to establish these networks of expertise. You've had to work and share data and knowledge across borders. You've got such a diverse community from, babies being born with rare neurological or genetic conditions to elderly people affected. And I think when I see the advocates who are involved, from parents to family members to representatives of patient organizations, they're so empowered, they're so engaged, and they're so positive in terms of the change that can be made. So I guess what I'd like to finish on is the fact that there is such a crossover between neurology and rare diseases that we shouldn't be operating as two separate fields and almost sort of competing for resources, but really we should be adding value and complementing one another and looking at the common challenges, but also the common solutions and opportunities that we now have in front of us if we really want to make a change. And for me, I think the ERNs are a central aspect of all of that work. And as EFNA, we're very happy to support that in any way we can. So thank you for allowing us to make a short contribution, and happy to work together from this policy advocacy perspective, which is what we do, to complement the medical and scientific work going on elsewhere.
Thank you, Donna. I couldn't agree with your last statement. And I think the European reference networks on rare neurological diseases is already bringing together rare diseases and neurology, and I think we should well, benefit from what is in place and really, I think, take the assets we have on both sides, so rare diseases and neurology, and then use it to improve care for the rare disease patient, but also for neurology patients. And I think there are lessons which can be learned from both sides and then being used for the respectively other side. And I also wanted to briefly comment on the ambiguous role Corona has played, at least for the policy making on European level. So I fully agree. Corona, I think, so rare disease patients, I think, were one of the patient groups which were most affected by the Corona pandemics. However, on European policy level, it actually helped to raise the awareness for a public health policy, which is needed on European level. And actually, when one have a look at the new EU for Health program, it greatly benefited from this, from the experience of the pandemic, and it now has a lot of European level activities, including European reference networks in its program. So it's really ambiguous, but I think it's in a way it has helped to really place the public health and rare disease on a political level, on a European political level. The fifth presentation now will take the rare disease patient perspective in Germany, and the presentation will be given by Tobias Menzel. So Dr. Tobias Menzel is chairman of the board of ELA Germany, so European Leukodystrophy Association, and a European patient advocate of the European Reference Network for rare neurological diseases. As a father of an 8-year-old child with a leukodystrophy, it tries to connect physicians, patients, and scientists to support research and to improve supportive care for patients. So ELA Germany is a patient organization for leukodystrophies, and based in Germany. Leukodystrophies are hereditary diseases which affect the myelin development and the central nervous system in children and adults. And with that, I hand over to Tobias. Thank you.
Thank you, Holm, for the kind. Here you go. Thank you, Holm, for the kind introduction, and also for the opportunity to give the patient perspective today in this session. As you mentioned, I have double role for representing a patient association, but also being a patient advocate in the ERN-RND, together with 7 other colleagues, which contribute and try to bring in patient perspective into the ERN. I think many points which I have later in my presentation are already addressed, but first of all, I would like to give a bit of base on leukodystrophy, as these are the diseases which keeps us busy all day, at least me and our family, and this provides a specific case. Yeah, leukodystrophies are white matter diseases in a normal, healthy brain. Nerve fibers are usually wrapped by myelin sheets, similar as in an electric cable, and this myelin sheet provide that these nerves are protected and are conductive. In leukodystrophies, these myelin sheets are destroyed or not correctly built up or degenerate. All leukodystrophies are inherited diseases, even if the onset is not right away after birth usually, but later on. There are around 150 genes which, when they are mutated, can cause leukodystrophies, and altogether actually it's more than 30 different diseases which we group together as leukodystrophies, and actually 1 out of 7,700 newborns is affected with leukodystrophy, and mostly, but not exclusively, these are children's. Next slide, please. And this is quite abstract if you say, well, the nerve fiber is not well wrapped with myelin that has, of course, heavy consequences. So in the moment the leukodystrophy sets on, usually patients, being children or adults, they start to lose focus or stumble depending on the actual disease type. And stepwise, maybe before you have even a diagnosis, children lose all abilities, all skills, being sight, speech, ability to hear or to walk. So it's quite a hard development for families, and not only for the patients, yes, but rather for also the families around them. Next slide, please. So this is taken from example from metachromatic leukodystrophy, but it's true for other leukodystrophies as well. In the moment the family gets the diagnosis that one of their children is suffering from a leukodystrophy, everything changes. Your normal life, whatever plans you did in your life, forget about them. It's filled with doctor's appointments, long hours of care, around 17 hours. It sounds tremendous, but it's like this, which even when there's no corona, you end up in isolation. And of course, it impacts also family life. Loss of income, also, for example, my wife stopped working to care for the child, and this is like a standard case. And other financial constraints as you build a lift or buy a special car or things like this, leading also to feeling of being overwhelmed, and you stop doing your normal hobbies if you're not giving a talk in the session. Next slide, yes. So how to improve care and how to help such families. I think this needs to be tackled from all sides, and patient organizations and the ERN have a big role in that. So this is, of course, raising awareness and providing knowledge, not only to patients. This is one focus, for example, patient associations as ELA have, but also providing information about rare neurological diseases, as the ERN does very well. But it's also counseling directly the family, because nobody can expect medical professionals to know everything about such a rare neurological disease and know the concrete helps families need. So even patient advocates and patient associations are needed to fill this gap, but mostly to bring people together and connect people, being patients with patients, patients with clinicians, or clinicians between each other. This is also a main function of the ERN as I see it, and this is crucial. Next slide. We have heard several times about the diagnosis odyssey, and this counts true for each family we have in our organization. All have a long history till they got the diagnosis, and this is in particular tricky, as luckily for some leukodystrophies there are therapeutic options for a few, but the window of opportunity is very small. So it's extremely important to get quickly to a diagnosis, and that means that clinicians need to be very aware and listen carefully. That's important, and it's a very common case that families report that they were categorized as oversensitive parents. So this being aware and open and listening carefully is important, but also then reaching out to other colleagues and specialists, taking the file of the patient or the patient itself and bring it and consultate other centers. I think the ERN is a perfect structure to support this, yeah, and also other organizations are happy to support that that process. And last but not least, providing information. As today also, for example, this is a perfect example, way how to teach about different diseases and what to do about it and how to recognize them. I think I already used my 5 minute slot, but let me end with maybe the last slide, yeah, with a key message, and this is communication. Yeah, I mean, all issues Donna, for example, addressed well, yeah, and they end up all together in communication. For rare diseases, this is crucial and more important than everything. Communication from patients to other patients, communicate between medical professionals and in each direction to connect knowledge and gaining speed for therapeutic options and diagnosis. Thank you.
Yeah, thank you very much, Tobias. I think you made your point very clear, which is on bringing people together, sharing knowledge, raising awareness, and by that really using the opportunities which networks and organizations. So I think the best is mixed organizations, so including patient representatives and clinicians and researchers, and using these networks to actually advance the care and the research of rare diseases. And I think for leukodystrophies and for the involvement in the European reference nets for rare diseases, I think a point can be made. So this is kind of successful, but however, I think there's also a number of open issues which we might be discussing. So thanks again. So well, as we all have spent a bit more than 5 minutes on our presentations, and we have to finish 4 p.m. sharp, there is just a little time for questions. So I invite all of you to post your questions through the chat or through the question and answer box, and actually deviate a bit from the plans we had in the beginning. And I would like to take one of the questions which was asked in the Q&A box, and would ask this question to Sophie. And it actually was a question which I found quite intriguing as well. So you mentioned that you, in order to raise awareness of GPs, which I agree is one of the critical points to really improve rare disease care, so that you implemented a respective program to do so in the French network. And I really would be interesting how you did it and what methodology you applied.
We have been in, can you hear me? Yes? Yep. Okay. We have been in contact with the National College of the French GP, which where maybe something like 40,000 GPs are recorded. And we are really working with them for the last 3 years on enhancing the communication, explaining them what was the RD organization in France, because not all of them were really aware of this organization of rare disease centers and what is exactly the journey for a rare disease patient and etc. And sometimes they didn't even know that there were RD experts in France. So the first thing was to tell them, okay, we are here, this is our email and blah, blah, blah. And it was just for them to know what was the mapping in France actually and where to find us. And then it was just to try to tell them, okay, now when you're facing a complex diagnosis, please can you just think and try to shift your mind to say, okay, this is a kind of complex panel of symptoms which are really unusual. Could it be something different from what I'm used to say? And just to say, okay, I will try to refer this patient to maybe an expert just to see what could it be, instead of sending the patient to a specialist in town, and then the patient will be back to the GP saying, I have no diagnosis yet, and this is ongoing for years and years and years. So it was just for the moment very basic things, quite general information on what is the journey, where to find us, and etc. And then in the next step, that will be to try to going into the clinic maybe more specialists through tutorial videos to teach them to recognize RND patients. So first we have to do it really step by steps and starting with very basic things, but it takes very long time to do so.
Yeah, well, I think that's the impression we also have here in Germany. So perhaps, Tobias, I could ask you about your experience on raising awareness just among the clinicians which care for your kid, and what experience you did, and also if these clinicians and physicians are aware of the respective rare disease centers, and perhaps also if they are already aware that something like a European reference networks exist.
My personal experience, but I think that's similar for many patients, is very mixed ones. Yeah. So you see people which are, or clinicians which are very engaged. Yeah. And some which are kind of, not ignorant is the wrong word, but are kind of too, let's say, superficial. Yeah. In the daily routine. Yeah. One thing what I realized with the doctor which did actually the diagnosis, he was extremely engaged. Nevertheless, he missed one important point, but which is bringing us to an expert center. Kind of the end is, this is a diagnosis. I'm sorry, you can call me whenever you need help, but there's nothing you can do. And this is formally correct because there is no treatment which is registered. Yeah. Nevertheless, there are possibilities and different ways to care. So it would be important to kind of take the patient and bring him one step forward. This is not a medical responsibility directly, but still. And there is no formal process. And this we see often enough. Yeah, we see also the opposite. Yeah, kind of that clinicians really provide or reach out to specialist centers. And we see in even the extreme case that clinicians say, well, you don't need to go to an expert center. I can take care of your daily routine as well. So you see all flavors. Yeah. And I think we have been somewhere in the middle. This is something which I think needs to grow and needs to be.
Yeah, so actually that's something the European Reference Network is involved with as well, together with the European Brain Council. So we are trying to, not in the field of leukodystrophies, but in the field of ataxias and dystonias, and we try to prove that really, well, scientifically prove that expertise centers have a concrete value for patient care. So Judith, can you actually share this experience that from the Hungarian perspective, so that the referral to an expertise center is the most important step?
I believe that it is a very important step to be referred to the center of expertise. But I agree that on the GP level, we have to do a lot of things, and on the medical students level as well, because until I can realize that many of the medical students, when we are talking about the rare disorders, they believe that they never will meet a patient with a rare disease, you know. It's such a unit. So I think we have to reduce the mystification. And this must be at the university. And since we changed our mind and the strategy, and for example, in the course Clinical Genetics, we have a workshop and it's titled From Common to the Rare, you know, and we are starting with a patient who has a stroke and it's coming to the emergency room, and all patients will have a rare disease. And they understand that even the patients with stroke, which is the most common disease, may have a very rare disease. They change their mind. But it was a process for us to understand how to teach them, you know, because if I am just going and yes, it's very interesting, very nice, soft cases, but they say, oh, I never will see it. And I think we have to change the general neurologist aspects as well. And they have to believe that they will see these patients. And in this case, the patients will arrive in time to the center of expertise, you know. So I think we have to work at the university level and the GP level, and then the general neurologist level, and then we will arrive in time to the center of expertise.
Yeah, so I think that's a complementary approach to what Sophie described. So using education and training to educate the respective medical students about rare diseases, and then by that making sure that once they are in practice, that they are more competent at least recognizing rare disease patients. So Donna, if I would give you the last word, and taking into consideration that you at EFNA have developed a vision for better quality of life with people in Europe living with a neurologic disease. So how would you actually wrap that up, and how would you see that this vision comes true for rare neurologic disease patients?
Yeah, so I think for me, clearly what we've seen throughout the presentations and the discussion today is the real added value of the ERNs. And I think as a community, a multi-stakeholder community, we need to really convince the policymakers and decision makers of that added value. And you mentioned the work you're doing with the European Brain Council on the value of treatment to make that kind of
Yes.
economic case for that argument. But I think what we can also bring is a real perspective from the patient community and from the medical community in a more narrative form, maybe, to really explain why the ERNs are important and how they can solve the challenges that are facing Europe from a public health perspective. Because as you've all said, you know, individual rare diseases are rare, but together you're looking at a lot of patients. And even within the neurological disorders that, you know, I mentioned earlier are common, there's a major rare component, you know, in young onset Parkinson's or some of the complex epilepsies or, you know, the frontal dementias. So even within common neurological disorders, there's a major rare component. And as we move, I think, towards this precision medicine approach, towards the digital transformation of healthcare, as we're thinking about future-proofing our healthcare systems and what that will look like, I think we really need to come together to position the ERNs as a solution in all of the consultations and in all of the initiatives that are being discussed at an EU level, and really articulating the added value that the ERNs can bring to patients on the ground in the European member states. And this is a clear win. You know, the Commission and the European policymakers like to invest and support things that work. And I think the ERNs is an example of that, you know, a tangible, concrete, positive outcome for patients. So I think working together, we can really make that case.